At least 5 states have put their health infrastructure on alert mode after the centre's directive to review readiness in view of a surge in respiratory illnesses among children in China. Now, state governments in Rajasthan, Karnataka, Gujarat, Uttarakhand and Tamil Nadu have actually asked hospitals as well as healthcare staff to ensure preparedness to tackle patients complaining of respiratory issues. If we talk about Karnataka, the health department has asked citizens to be aware of the seasonal flu. The advisory issued by Rajasthan, meanwhile, said the situation is not worrisome at present, but the medical staff should be alert and prevent the spread of infectious diseases. In Gujarat, the health minister has said the healthcare infrastructure created during the COVID-19 pandemic was actually being strengthened as a precautionary measure in view of what's happening in China at the moment. The Uttarakhand government directed health officials to step up surveillance for cases of respiratory illnesses. As you know, 3 districts of Uttarakhand, Chamoli, Uttarkashi and Pithoragarh share borders with China. Now, listing the symptoms and risk factors of the seasonal flu, this advisory also mentions the do's and don'ts. These include covering the mouth and nose while coughing or sneezing, frequent washing of hands as you're probably used to after the pandemic, avoiding touching the face and using masks in crowded spots. In fact, the Union Health Ministry has said the situation as we speak is not alarming, but it is closely monitoring it. But as per internal accounts in China, this current outbreak has swamped some hospitals in northern China, including in Beijing, and health authorities have asked the public to take children with less severe symptoms to clinics as well as other facilities. The World Health Organization, meanwhile, has said there was too little information at the moment to properly assess the risk of these reported cases of respiratory illnesses as far as children in China are concerned. But the WHO said Chinese health officials provided the data that it requested, and the data showed an increase in hospital admissions of children due to diseases including bacterial infection, RSV, influenza, the common cold in some cases since about October this year. Chinese officials, meanwhile, have maintained the surge in patients has not overloaded the country's hospitals. This is what the WHO has disclosed. But you have to crucially note that it is rare for the UN Health Agency to publicly ask for more detailed information from countries, as such requests are typically made internally. Now, the WHO has further added that it requested further data from China via an international legal mechanism. But this surge, particularly among kids, has sparked concern 4 years after COVID emerged from China and went on to become a pandemic that changed the world. Epidemiologists so far say this surge is to be expected, given that this is China's first winter since the COVID pandemic began, that the country has been free of any COVID restrictions.